Hi everyone, my name is Sai Praneeth and my friend Vamshi. We are going to discuss about information retrieval in healthcare. Let's get started. Information retrieval in healthcare refers to the process of accessing and managing vast amounts of data, such as patient records, medical literature, and imaging. Given the massive and complex nature of healthcare data, IR systems are essential for sorting, analyzing, and presenting data to healthcare professionals in meaningful ways. That is providing meaningful insights to the professionals. By doing so, plays a pivotal role in decision making, patient care, and research advancements. Importance of IR in healthcare. Enhanced patient care. IR systems allow healthcare providers to access a patient's entire medical history, lab results, imaging, and other critical data quickly. This means a doctor or nurse can make more accurate, personal decisions without wasting time searching for details, ultimately enhancing patients' outcomes. Another one is improved efficiency. IR helps streamline operations by enabling quick access to relevant information. This reduces the administrative workload, allowing professionals to focus on patient care. For example, a doctor can find relevant research or patient data in seconds rather than minutes or hours. Another one is reduced errors. In healthcare, even a small error can serve consequences. IR systems help by providing accurate, up-to-date information directly at the point of care, significantly reducing the likelihood of errors due to missing or outdated information. Another one is research and development. Medical research benefits greatly from IR as it enables researchers to analyze large data sets, identifying patterns, trends, and potential breakthroughs. IR supports the development of new treatments by providing access to clinical data, published studies, and more, which is essential for evidence based medicine. Let's discuss about clinical decision support systems. These are the tools that use IR to assist healthcare providers in making data driven decisions in areas like diagnosis, treatment planning, and risk prediction. One of them is diagnose support. CDSs analyze patient data such as symptoms, medical history, and results to provide evidence based recommendations. This analysis helps physicians make faster, more accurate diagnoses by suggesting possible diseases or conditions based on the available data. Another one is treatment planning. Once a diagnosis is made, CDSs can suggest treatment plans tailored to the patient's unique needs. For instance, a system might recommend specific drug dosages based on patient's age, weight, and health status. This is very useful. Another one is medication management. CDSs alerts healthcare providers to potential drug interactions and side effects. This is crucial for patient safety as certain drugs can have harmful interactions if taken together. These alerts help providers prescribe medication more safely. The last one, risk prediction. By analyzing various data points, CDSs can predict a patient's likelihood of developing certain conditions such as diabetes or cardiovascular disease. Early prediction allows for preventive measures such as lifestyle changes that can significantly reduce a patient's risk. Next slide. Let's discuss about some of the challenges in medical information retrieval. IR systems in healthcare face several challenges. Out of them, one of the challenges in medical information retrieval is data silos. Patient data is often stored in isolated systems such as EHRs, lab systems, or pharmacy databases, making it difficult to retrieve a complete view of patient's health. Bridging these silos is critical for effective IR. The next one is data security. Protecting patient data is a top priority as healthcare data is highly sensitive. IR systems must adhere to strict security standards and regulatory requirements such as HIPAA in the United States to ensure patient privacy and confidentiality. Interoperability. Different healthcare systems use unique data formats and standards, which complicates data sharing and integration. Without interoperability, it's challenging for IR systems to retrieve and integrate data from various sources accurately, which limits the effectiveness. And there are so many other challenges in this field. Out of these are the most priority one. Now my friend Vamshi will discuss more on this. Thank you.
Hello everyone, I am Vamshi Krishna. First of all, thanks my friend Pranit to giving the brief introduction for this concept. Today I am going to explain about semantic search and NLP, natural language processing. Well, coming to this topic, traditional keyword based searches can miss crucial information in complex queries. Semantic search and NLP improve by information retrieval by allowing the systems to interrupt meaning and context. Well, coming to the first content, semantic search, this approach improves searches accuracy by focusing on the meaning of words rather than exact matches. For example, if a clinician searches for heart attack treatment, a semantic search engine will retrieve relevant results. If the data uses terms like myocardial infarction, the semantic search goes beyond keyword matching, understanding the meaning and context of queries to retrieve relevant information. Well, coming to the second point, natural language processing. NLP enables computers to understand and process human language, facilitating more natural and initiative interactions with healthcare information systems. NLP processes and interprets human languages, making it possible to search and interact with healthcare data and more intuitively. For an instance, a doctor can ask the system what are the most recent findings on type 2 diabetes treatment, and he get an intelligent response without having any specific medical terminology. Well, coming to the next topic is knowledge graphs. These graphs represent relationships between medical entities and providing a structured framework for semantic search and analysis. Coming to the briefly, knowledge graphs map relationships between healthcare entities such as symptoms, conditions, and treatments. For an example, they can visually show the connections between hypertension, cardiovascular risk, and recommended meditation. This structure helps information retrieval systems understand complex relationships, making it easier for providers to find relevant information and see how various medical factors interact. Well, coming to the next slide, personalized patient information retrieval. Personalized information retrieval customizes search results and information based on individual patient profiles, allowing clinicians and patients to access the tailored data. In this slide, I am going to explain patient-specific data and personalized recommendations and also patient's engagement. Well, coming to the patient-specific data, which is allows for quick access to critical information specific to each patient, such as medical history, allergies, and various drug reactions. By focusing on patient-relevant information, information retriever can provide the data that directly impacts the patient's care. Well, coming to the personalized recommendations, which are providing tailored advice and treatment options based on patients' specific factors. With personalized information retrieval, treatment plans and health recommendations can be tailored to each patient's unique circumstances. For an instance, a diabetic patient might receive dietary recommendations based on their blood sugar patterns and activity level. And coming to the final one, patient engagement, which empowering patients with access to their own health information and promoting active participation in their care. These allowing patients access to their data empowers them to take an active role in their healthcare. For instance, a patient managing a chronic condition can regularly check their lab results, review doctor's notes, and monitor medication adherence, and listing the items and fostering better health outcomes. Now I am going to explain integrating the patient data from multiple sources. Well, coming to the first source, electronic health records, also known as EHRs. Integration of patient data from various sources is very essential for building a complete and cohesive view of each patient's health. In healthcare, Data is often generated and stored across a variety of systems and devices, each contributing unique and valuable information about a patient's medical history and current health status. Integrating these sources allows healthcare providers to access all relevant patients' information in one place, enabling more accurate and diagnosis, effective treatments, and personalized care. Here is the closer look at each source of the data which we are going to explain. The first one is EHR, also known as electronic health records. EHR serves as the digital version of a patient's paper chart and are typically maintained within the healthcare facilities. They include a comprehensive overview of patients' medical histories, medications, and also treatment notes, lab test results, allergies, and vaccination records. Integration with EHR is crucial because they house primary care information, providing a solid foundation for patients' medical history. By having a centralized access point, EHR data, healthcare providers can ensure continuity of care even if the patient visits the different departments or facility. Well, coming to the next one, medical imaging system. Medical imaging systems store data from diagnostic tests like X-rays and CT scans and MRIs and also ultrasound images. These images are essential for diagnosing and monitoring the various conditions from fractures to tumors. Because these files are large and complex, they are often stored in separate imaging databases rather than within the EHRs. Integrating these imaging systems with other health records is important for clinicians who need to view both a patient's medical history and also current diagnostic images side by side. This integration helps ensure that decisions are based on the most comprehensive information possible, facilitating more accurate diagnosis and personalized treatment planning. Well, coming to the next one, wearable devices. These, such as fitness trackers, smartwatches, and medical devices like glucose monitors or blood pressure cuffs, provide continuous real-time data about patients' health matrices. For instance, wearables can track activity levels, heart rate, and sleep patterns, and also glucose levels. With these chronic diseases like diabetes or hypertension, which wearables provide valuable data points that help track progress and detect early signs of complication. By integrating wearable data with EHRs and other systems, clinicians gain a fuller picture of patients' health beyond clinical visits and enabling a more proactive preventive approach to care. Well, coming to the final one, which is nothing but Health Information Network, also known as HINs, are systems that allow data to be shared across different healthcare providers and institutions. For instance, if a patient visits the hospital, an HIN enables the specialist to access the patient's full medical history, full medical record, including past treatments, medications, and allergies, even if these records were originally stored in another illusion. Integration with HINs ensures the patient's data is easily and securely accessible regardless of geographic or institutional boundaries, making it possible for healthcare professionals to provide, coordinate, and consistent care. This integration is especially beneficial in emergencies where having immediate access to comprehensive medical information system. In this slide, I am going to explain future trends and opportunities. The first one is artificial intelligence. AI enhances IR by automating data analysis and enabling predictive insights. For instance, an AI-driven IR system could analyze millions of records to find patterns that predict the disease onset or recommend preventive measures for high-risk patients. Well, coming to the second one, big data analytics, which allows information retrieval systems to process large data sets, identifying population health trends and patterns. For instance, during a pandemic, big data can help health officials track the spread of disease and allocate resources according to the need. Well, coming to the cloud computing, cloud-based information retrieval systems can scale up to handle vast amount of data without the need for heavy on-premises infrastructure. This scalability is especially useful for handling large imaging files, EHRs, and real-time data from wearable devices. Well, coming to the blockchain technology, which can secure patient data as it creates a decentralized, tamper-proof ledger of health information. This is especially valuable in patient privacy and data sharing scenarios, where a transparent, variable system helps maintain trust while ensuring data security. Well, coming to the conclusion, in a summary, IR in healthcare is not only about storing and retrieving data, and it also is also about transforming raw data into actionable insights. By advancing IR with technologies like AI, NLP, and blockchain, healthcare systems can make significant strides towards personalized and efficient in secure patient care. These systems empower clinicians to make better decisions and help researchers unlock new pathways to improve public health, making IR a cornerstone of the future of healthcare. And thank you. It's all about information retrieval in healthcare. Thank you.